Hey guys, come along with me today to do some upper face treatment and some TMJ treatment. As you can see, I have this patient marked up. I have her lateral borders of her frontalis marked, and then my injection sites are about nickel to dime size spacing apart. As you can see, I'm working my way across that frontalis. I'm about a 45-degree angle, half needle depth. You really want to place this product exactly where you want it so the patient gets the best results as possible. I'm making sure that I'm being very precise about where I'm putting this product and putting it evenly across that frontalis so she has nice even diffusion throughout and we will not have to do an enhancement. Enhancements are normal though, so keep that in mind. You might want to bring your patient back for a 2-week follow-up. This is a reoccurring patient. We have her dosed down to a T, so we're just rolling with it. Next up, we are doing a little bit of a brow lift. So as you can see, I'm very superficial. I'm going in parallel with the brow, about a 30-degree angle, and I am, once again, very superficial. So it might be a little hard to push product there. It's completely normal. Just push low and slow. And then next up, we are doing the glabella injection. So that Proceris is a 90-degree injection, 3/4 to full needle depth, and then you have your medial and lateral corrugators on each side. Your medial corrugators are going to be a true 3/4 depth. So as you can see, when I'm injecting right here, I'm really making sure I'm at a 3/4 needle depth. And when you get to the lateral corrugator, it's going to be a true half needle depth because as you get more lateral, those corrugators start to thin out and your frontalis is underneath that. So if you ever get a droopy brow, make sure that you are checking your depth on those lateral corrugators to make sure it's appropriate. We are also doing a little bit of crow's feet. So as you can see, I'm over that orbital rim. I marked my patient up when she was smiling and animating so I can see where those crow's feet were forming. And I am always injecting up and away from the eye. So very superficial again, about a 30-degree angle. And I'm about just the tip or a quarter of that needle depth in. You want it to bleb like a TB test. So you're aiming for that superficial portion of that muscle. Moving on, we're moving on to her TMJ. As you can see, I am treating her masseter muscles. I have that anterior and posterior border of that masseter marked up. I am going in at a 90-degree angle, 3/4 to full needle depth. I do a 2-point injection here just to make sure I get a nice even spread. We are also treating her deep masseters. So as you can see, I'm going up at a 45-degree angle up towards that tragus. And that's about a 3/4 needle depth. So make sure you can localize that muscle before you inject it. It is very close to that risorius muscle, so make sure that your injection technique is accurate and you're comfortable with injecting that muscle. If you are not, make sure that you educate your patient on risks and complications that can happen, which is hitting the wrong muscle. In this case, it would be the risorius and their smile would look wonky. Moving on to this temporalis, she has very severe headaches. As you can see, her temporalis muscle is very strong, so we're doing a multiple point injection here. More anterior where she's focused in on those headaches and migraines. And we do this every 3 months. She is a severe TMJ patient. So as you can see, her temporalis is very much bulging outside of that hairline. So it is okay to treat outside of that hairline as long as you can identify that muscle clearly and that you're confident in where you're injecting. Obviously, we're not trying to put any of her other muscles at risk. So make sure you can clearly identify that muscle and inject it. It's going to be a 45-degree angle, half needle depth up back into that hairline when you inject that temporalis. Here we are injecting that splenius capitis. I am applying pressure to that splenius capitis and asking her where her pain is located. Once I am locating it, I'm alcoholing that area really well. And this injection is going to be an injection up towards that occipital at a 45-degree angle.